Hi, I'm Joan Johnson from J. Johnson Education Center, and I'm going to be presenting a skill for you today. We're going to be doing passive range of motion to the shoulder and to the knee and the hip. So, one of the things that we do before we come into a patient's room is we always knock and we wait for them to ask us to enter, correct? And then once we do that and we come in, we want to make sure that the bed is locked. And we also want to hand sanitize. We also want to introduce ourselves, and we also want to know who our client is, or patient or resident. I have this person covered because we are going to be doing exercises to the shoulder, because we only want to expose the area that we are actually working with. So I'm going to take her arm out, and I'm going to support the wrist and the elbow. And look at my body mechanics as well. And I'm going to be going to the ear and coming back down, and we're going to do that 3 times. 1, 2, 3. And I am still supporting the wrist and the elbow. Then I'm going to kind of turn to the side. I'm going to switch the position of my hand, and we're going to take the arms out to the side. We call that abduct and adduct, but residents may not always understand that. So we're just going to say we're going to do the exercise where your arms are going to go away from your body and come back, okay? I'm still supporting the wrist and the elbow. 1, 2, look at my body mechanics, and 3. When I'm done, I am going to put her arm back under there. Now, I'm going to do the exercise for the knee and the hip. Okay? Still maintaining her being covered, right? My hand up under her what? Knee and her ankle. And I'm going to lift that up. 1, 2, 3. And I'm going to do the same thing that I did with the shoulder and the arm. I'm going to step 1, 2, 3. And then I'm going to cover her back up. Now, it's always a good thing that when you're doing skills with people and they are in the bed, to always lift that bed up a little bit so that you're not bending so far, okay? You can do that. And then when you're all done, of course, you're going to do what? Put the bed back down, right? Then I'm going to do what? Give the resident their call light. I'm making sure that my bed is still locked, making sure that my patient is comfortable. And there's something else. Always ask that resident when you're doing that exercise, are they in pain? Did they have any pain? You need to ask that at least once during the shoulder exercise and the knee exercise, hip exercise. Okay, so thank you so much. This is Joan Johnson signing off. Thank you for tuning in, and we hope that this helps you.